we have the MEC for Health and Wellness in Gauteng, Ms. Nobantu Nkomo Ralehoko, joining us here. A very good morning, MEC. How are you doing today?
Morning to you too, and morning to the listeners at home.
Yes. So to make the communication and also the sound better, can you please, speak closely to the mic because the information that you're going to speak it's very vital. Very vital.
Yeah, using the health language now makes yes, it's vital and healthy for our peers.
Right. So MEC, thank you so much for joining us right here on the Vuga Breakfast Show.
Thank you for having me too.
Yeah. So now we're at the Rain Show 2025. And as the public service, you are here. And you know that when people come to the Rain Show, obviously it is an expo center. People want to know information, what's new on the block, what are rollovers as the public sector has for the people. So in terms of your involvement with the Rain Show, can you please take us through what is your involvement with the Rain Show?
Almost every financial year, we always make sure that we come to the Run Show as the Department of Health and Wellness. Because besides that, all the Gauteng provincial government departments are displaying what they are capable of doing, sharing information with the citizens. But the Department of Health, then, what we are doing on our side is to bring the stalls, especially I always say it's a clinic on the wheels.
Yeah.
We bring our clinics on the wheels because you can get all type of services on the wheels. As we speak, we have doctors, we have nurses that are on site that are checking the young ones, including the elders, who are screening diabetes, who are screening cancer, who are screening on cancer, but in doing even pap smear to the parents. But we are immunizing the young ones. Their parents are bringing them. We are checking them. If they have the road to health certificate, they must bring those certificates if they are sending support. Because we want to be sure if the child didn't get some of the immunizations that government should do. But again, in our stores, we have all sorts of services. The EMS, which is emergency services, it's there. Remember now, during this period, which is Easter period, to find that we have floods, we have a fire, as we have seen on the 19th of April, we had fire in Tembisa.
Yeah.
So our teams are displaying what we are capable of. On Friday in the morning, we're at Zulek, we're displaying the capacity that we have in terms of people when there are floods. How can we assist those people? But again, we are showing off this work because we are even assisting other provinces. If you remember the incident in Limpopo, when that bus fell, we were there, we were assisting our colleagues in Africa, we were assisting our colleagues in the SADC countries. So quite a number of work, including in Northwest, during that incident, you remember, of the mine.
Yeah.
Our colleagues are the ones that assisted in exhuming some of those bodies on underground. So that's the work that we're doing as a Department of Health, with our showcasing them. But again, our forensic team is there. Yes. Remember, the forensic team, part of it deals with the DNA.
Yeah.
So those teams are there. We're working very closely with the Department of Community Safety and the National Department in terms of that. If you remember, there was a recent incident of 2 months back of families that we lost in Harry Smith in an accident. We are the ones that had to go to Free State and make sure that those families are able to identify their bodies. DNA tests are done. You remember the Marshalltown fire incident of the buildings? My team was there, and they acted both forensic and EMS services. So they were showcasing the good work that we are doing. But another thing that we felt that we should come to yourselves as VUCA Breakfast Show share is to tell the citizens about the work that we're doing in our hospitals. We have 4 academic hospitals that are big. All the 4, 3 out of those, we have employed young CEOs. The performance of those academic hospitals, as we speak on oncology itself, if you can go to Steve Biko, we don't have a backlog on Steve Biko on cancer patients. The people that are in the system are the people that are getting their medication, that are already being treated by us. So, but you can see the level of performance that our clinical teams are doing in our hospitals. I was at Malberton last week. I saw the machines that the private sector is giving our people. Just the ventilators machine are old machines. But if you can just go here at Bara, you will see the best machines that we have. We are even beating Mill Park in terms of the technology, which we call it health technology. the best of its kind. You will find it there. We have the machines that you put a person, a patient, they will tell you that now this patient must be turned. This is the treatment that you must give to the patient. This is the dosage that you must give the patient at the critical care. So in all these institutions that were buying the machines, we have seen Dr. George Mukari Hospital, that is in Garankuwa, the equipment that we have just renovated and showcased that you have just bought there in that hospital, so that we don't rely to Steve Biko or Charlotte McClake in terms of the equipment. So this is the thing. These are the things that we want to come to you, and in fact, we want to partner with yourselves as Vuka Prefer Show. Because if we work with you, you deal directly with the citizen. You are a community radio station. You work with those people that need this information most. So we'll come to you, because we'll come and talk to you about the teenage pregnancy that we're doing as a department. In the stores, we'll get those pamphlets. Hence, we're doing even a pap smear there. We're checking the children. We're screening high blood. We're screening diabetes. Today, as we speak, here at Drone Show. So, but we need to spread that gospel. It must not only be here when you're at a Rand Easter show that I'll be able to tell the citizens. We must have that interaction with yourselves, even if it's once a month, so that I'm able to come and tell the citizens what is it that they can benefit from the department. For example, you deal with your communities. They always complain about queues in the hospital. Now we're installing queue management system in our hospitals, in our hospitals, especially the pharmacy and at the accident and emergency areas. In these areas where you find queues, we want to ease up that pressure. So the queue management is there. In this financial year, we'll be rolling it out to 11 hospitals. So wow, that queue management system. We've started at Charlotte McClake, at Raima Musa, at Edinvale Hospital, but we want to spread it to other areas. OD Hospital, that's another hospital that we have queue management system that we have installed. But now we're taking it up to other hospitals so that it becomes this aggressive. We have this aggressive approach now that we're doing. The other thing is e-filing that we're doing. Department of so that the patients don't lose their record. We don't lose the patient's records. So we have e-filing system that we have, and it's starting at Para. We've done it at Para. We went to Tele. We're finishing Tele. Went to Smugeng. They're busy. The team is busy at Smugeng Hospital. We're busy at Tambo Memorial Hospital, or Tambo Memorial Hospital. That is in Boxback. We're targeting these hospitals. I'm sure the question is, why do you start in those? We're starting the hospitals where we've been incidents of patient files that we lose. And that's where we're litigated in most cases. And that's where we're losing cases for litigation. Because if you're litigated and then you don't have enough information, the file is lost, definitely will not pay the battle, even if we go to court. So that's why we started in the hospitals where we have a high number of litigation cases that we had. But we're going to roll it out then to other hospitals. Already we're completing in other hospitals. But we'll take it even to the clinics, because we have bigger clinics, which you call them 24-hour clinics, which is community health service, CHCs when you call them. Those CHCs, we want to make sure that even their filing system is at the level. Because remember the emphasis now on primary health care because of NHI. NHI is critical, and it will start there at primary health. But again, we're at an advanced stage in terms of NHI. Hence, we're improving our facilities. That building that has been in Tembisa, it's part of the aggressive approach that we're doing as a department in renovating our facilities, but extending in some of the areas where we have small places, like the accident and emergency areas. Preparing ourselves for NHI, because it's going to start at the clinics, which is primary healthcare services, at the district hospitals, and at the regional hospitals. So hence, our focus is more on those areas. But again, we're registering now all the doctors that are operating in the communities, your GPs, because they must assist us on the NHI. They are part of the people that will be working very closely with the public sector now. So we're bringing them on board. So we have a framework that we're implementing now of talking to those doctors. They must be part of the registration, each and everyone. In fact, it's more of doing an audit and analyzing how many doctors in every ward. Do we have? that we have in every region. So we'll have them in the system so that when they start assisting us on our patients, we are readily available in terms of knowing it's Dr. Sorenso, it's registered, it's legit, and these are the details of the doctor that we can go to. Then when they check the patients, they are able to come and get their monies because we'll be paying them. Remember, NHI, it's a fund.
Yes.
It's the fund. It's not just other people don't understand that. We're talking about the fund that will be there, and there will be a board that manages that fund, and that board will be working very closely with the hospitals, including the Department of Health, will be central to that.
Very informative. More, I love. She gave so much information and knowledge, right? And I love how you mentioned that you don't want that this information ends here at the Rancho, right? Because someone is only seeing your exhibition here, and the MEC is only coming on Monday. But the aim is to push and roll out all of this information, even over and above just this weekend. So, with saying that, now let's talk priorities, right? What are some of the priorities that the department is identifying and saying these are the ones that we want to tackle right now on the ground? Because you're mentioning primary care health, that's where you want to tackle it and go as it levels up, right? So you as the MEC, what have you identified or seen that these are the priorities and these are the ones that we want to deal with now so that people have the correct information and we debunk all of these misconceptions that are out there?
One of those is patients' care. We have even launched a campaign now that is called I Serve with a Smile.
I serve with a smile.
Yes, because that campaign, it helps us so that when the patients are there, we treat them with dignity. So the other one is to bring in the stakeholders out of that because we want to make sure that our key stakeholders are being taken care of by Head of Health. Then the other part of the priorities is the infrastructure rollout to the communities. Yeah, they're building new hospitals, but we're renovating some of the hospitals.
I love it. I love it.
Yeah, so MEC, thank you so much, for addressing that because there are a lot of misconceptions that people are having in terms of, the healthcare system in South Africa. Because I gotta tell you that, when you speak about ensuring and safety, quality health care for the citizens is what people want to hear. And now hearing that young people are now coming on board and being employed in the rollover that you guys have had. Because we see here that your mission is to create an effective public healthcare system in Gauteng by ensuring you have the right people, skills, system, and equipment to provide the care of the patients that need to live healthy and quality lives. So now, coming into making sure that we are evolving with the latest technologies, how far are you guys with implementing that?
We have improved even in that side of ICT. In fact, we have now a CIO in the department that is fully responsible for technology in our hospitals. We call that unit, where there's a part of the unit called health technology, because we have an aggressive approach now of buying the latest equipment to the hospitals, to the clinics. All our clinics now are having X-ray machines. So that you don't go to the clinic and then they say we need an X-ray, but we have to take it to a hospital. This will get there. Because want exactly what you're saying of strengthening our primary health care. That's why we're doing that. So we're aggressive in that approach of ICT. And we will make sure that we're strengthening our broadband, by the way, because we've been weak in terms of the broadband connectivity. So we're beefing it up, that broadband, working very closely with the Department of E-Government that is assisting us to ensure that when you are in the hospital, there is connectivity. When you're in the clinic, there is connectivity. So we're doing well in that space now. Hence, we're bringing then other services now. That is integrated queue management system that we want people to take. Not to experience sitting in the hospital for the whole day, better part of the day because the queue is long. Once we are managing that queue through this integrated queue management system, it's going to help us to assist and ease up the pressure that we've been having as a Department of Health. The use of e-filing, that's another tool that we believe that is going to help us, as I've indicated earlier on.
Very interesting. But, ABC, someone could say, let me play devil's advocate for a while, right? Or for a second. You're mentioning that even over and above just improving these hospitals that are there, you're even building new ones. But someone could say, MEC, it seems like you're focusing on urbanized areas. Right now, what is the plan that you guys might have as a plan of action to make sure that even those areas on the outskirts or rural areas have this accessibility to this healthcare service that you are mentioning and talking about, so that every citizen, any normal citizen in the Republic can say, I as well got the same service as someone in Sandton or someone in the greater, parts of Gauteng that are well off. I can also say that we receive the same healthcare service.
In the rural area, outskirts of the province, we call it West Rand City Bank.
Yes,
Trust me, I work very closely with those communities.
yes,
Those hospitals, including the clinics that side. And I was rolling out last month the mobile clinics. I gave them mobile clinics so that we're able to reach out. Where in areas where they are far from the clinics, at least the mobile clinic must reach those communities. So we don't leave them behind, rural areas.
Yeah, MEC, thank you so much for your time, because we would like to feed this information to our audience. So for people to know more on what you guys are doing and update, where can they find you guys and where can they find this kind of information?
They can find us on social media platforms under the Department of Health and Wellness. They must just punch there, will be available for them.
Yeah.
So they can again Google us, they will find us there.
Yeah, thank you so much. MEC, Ms. Nobantu Nkomo Ralehoko, right here on the Vuga Breakfast Show. Do make sure that you connect with us on every social media platforms.